So there are various certifications programs, sir. Anyway, medicine is providing all those certifications programs. Can you elaborate all these certifications, useful for which type of departments?
Okay. There are many certification exams. For outpatient coding, we have CPC.
I don't ask is there any shortcut
No.
for the certification, but is there any tips, how to go through the certifications training?
Okay.
So how to prepare for that exam?
To pass certification exam, there are no shortcuts. You have to do lot.
So there is a more demand for the inpatient coders, IPDRG coding. Last year and this year also I seen there are more opportunities in that, but people are not available. Skilled people are not available.
Inpatient coders demand is always high. I've seen from 2004, not now. Since 20 years I'm saying.
Sir, we see in US healthcare, Indian healthcare also, if medical coding is implemented in every field, not only inpatient, as you said, Ayushman Bharat,
Yes.
if it is implemented in every sector of the healthcare, so what are the opportunities going to be?
I'm very sure in next 4 to 5 years, ICD-10 going to be then everyone throughout India.
The Indian healthcare system digitalized, as like other nations also. Then there are
Yes.
so many opportunities, and
Exactly.
it is useful for everyone.
So I'm sure all coders who are learning American system now, next 3-4 years they come to Indian healthcare system only. Learn properly, practice very well, clear CHM, IHC exam, get a wonderful job.
So hi everyone, I'm Dr. Naresh. I have around 10 plus years experience in medical coding. Today we are here with Dr. Santosh Kumar Gupta, CEO of Medicine. So here today we are going to discuss about the various certifications programs and what are the tips to pass these certifications programs and what are the importance to do these certifications programs. So we will get all these informations, don't miss and watch this video. Hi sir.
Hi, Dr. Naresh.
So there are various certifications programs, sir. Anyway, medicine is providing all those certifications programs. Can you elaborate all these certifications, useful for which type of departments?
Okay.
So to have an idea to everyone.
Fine. See, there are many certification exams. For outpatient coding, we have CPC and CCSP from AIMA, CPC from AAPC. For inpatient coding, we have CIC from the AAPC and CCS from AHIMA. And for every specialty, we have the exam, like ED, anesthesia, HCC, surgery, etc., etc. So certification is must for every coder because it's a proof of education and dedication. And to pass this exam, you have to undergo training for 2 to 3 months and practice the medical records with the coding and get the proper knowledge to clear the exam. So we provide training for all specialties. If you take my example, I have cleared 45 certification exams,
Yes, sir.
including CPC. I got CPC in the year 2004. CPC, CCS, medical billing, medical coding auditing, and all specialties. You may ask one question, sir, why you done all certification exams? Why? Because if I don't learn, how can I teach? See, for example, now we get a lot of students, they come to our institute, they say, sir, they want to learn cardiology coding.
Okay.
They want to learn orthopedic coding. They want to learn gastroenterology coding. We need someone who can train, right?
Yes.
So definitely every quarter they want to upskill and upgrade to the next level. So to fill that gap, first of all, I worked in the US and I got training in all specialties. I cleared all specialty exams. Now I'm able to train the certified coders to upskill and upgrade them to next specialty. So at Medicine Medical Coding Academy, we give training for all specialties.
Sir, you have around 25 years plus experience. Sir. So there are various certifications programs that is given by the Medicine Academy. So let me know, in your experience, is there any, I don't ask is there any shortcut
No.
for the certification, but is there any tips, how to go through the certifications training.
Okay.
So how to prepare for that exam.
Okay.
So is there any concepts, are there specific concept to clear the examination? It will help for everyone.
Dr. Naresh, is a very good question. I have 20 years experience in medical coding and 5 years experience in the clinical practice. Basically, I'm a medical doctor. What I've seen is, to pass certification exam, there are no shortcuts.
Yeah.
You have to do a lot of hard work, learn the medical coding guidelines, practice extensively to clear the exam. If anybody says the shortcut is there, don't trust them. It's impossible. Integrity is very high in the certification exams. Even if you pass through shortcuts, they are going to revoke your certification. This happened many times.
Yeah.
So don't go for the shortcuts. Because when you go for the job, you have to work. You have to perform. You have to show your skill, right? So definitely, there are no shortcuts for the certification exam. But anyhow, if you prepare for 2 to 3 months properly with proper guidance, you can clear comfortably. Okay. Now coming to if you ask me tips and techniques.
Yes, sir.
See, certification exams are open book exams.
Yes.
So you can refer the book and you can assign the codes. In this 2 to 3 months of training, you will understand how to apply the guidelines and you will practice. So I'm going to explain about the ICD-10 now. In ICD-10, we get around 30 to 40 questions in the CPC exam, and CCS around 30 to 40. So I don't know, I won't say 30 to 40, but ICD is very important for any medical coder.
Yeah.
If you take ICD-10-CM, there are 22 chapters. Okay. Chapter number 1, HIV/AIDS coding is very, very important.
Yes, sir. High risk.
Sepsis coding, how to code sepsis, how to code septic shock. The difference between septic shock and severe sepsis. And how to code the COVID-19. Of course, COVID-19 comes in chapter number 22, but I'm just, because the guidelines are in the chapter number 1. And how to assign the code for the antibiotic resistance. So these topics are very important in chapter number 1. So when you're going for the exam, make sure you learn about the HIV/AIDS coding, sepsis coding, coding for the antibiotic resistance, and also for the COVID-19.
Yes, sir. I think COVID-19 is added at 2020, sir.
Yes, of course.
So, yeah.
After pandemic, yes, sorry.
Specific
It comes in chapter number 22. Yeah, but guidelines are in chapter number 1. Okay. In chapter number 2, neoplasm coding is very important.
Oh, yeah.
So you should know what is the meaning of metastasis, and difference between the benign and malignant tumors,
Yeah.
and how to code anemia and malignancy. So these are already there in the book. So you should know the guidelines. You should know how to apply the guidelines.
So this is the reason, sir. Actually, everyone goes through these guidelines.
Yes.
But in my career also, I seen, even for me also, even as a physician, understanding the document is not the same every time.
Exactly.
So many coders, whenever they get the cancer charts, they don't understand what is the physician documented.
So they don't know how to identify the primary, secondary,
and
what are the complications. Exactly,
yes,
that's true.
Metastasized.
Whether it's a history cancer, active cancer.
Yes, sir.
Yes.
Right.
So that's why they do mistakes. Yes.
And when to code history also, and also, sir, in office when I work in a different companies, so when our trainers also, they will go in a certain way. They will say that if you have any evidence for any cancer, then you can code.
Code is active cancer.
Yeah. So they will go with if you see any treatment, then you can code that cancer.
It's active. If there's no treatment, if they say there's no evidence of disease,
yes, sir.
then you can code as history of cancer.
Yeah.
The Z codes.
Yeah.
So as you said rightly, Dr. Naresh, these are the key things which they have to learn in the institute, any institute, because reading guidelines is one thing, applying guidelines is the second one.
Yes.
Yep.
As you said, coding the cancers is for the coders a bit difficult. Not only cancers, even pregnancy charts when they get
Yes.
So how to give a default code? So when they need to give an information which is default, they need to go.
Exactly.
It's not just in the document it is there. I need to code. It's not like that. They need to.
You have to see the medications.
Yes.
And again, you should understand that medications for the neoplasm or not.
Yeah.
So you should have the knowledge of pharmacology also, right?
Yes, sir.
So then only can code as active cancer.
Yeah. Even who completed their certifications, they know how to code, but in reality, they need to know about the common medications.
Yes, that's very, very important. Yes, that's why I say it's a continuing education. You cannot stop the education at one point of time.
Yeah.
Okay, and one more thing, diabetes coding is very, very important. So because when you do the live work, you get a lot of cases from the diabetes. So it's a very common condition.
Yeah.
And depression, how to code anxiety, depressions, right? Schizophrenia. These are very important for the coders.
Yes, sir. Diabetes is a top 10 error, sir.
Yes,
Diabetes,
people they do a lot of mistakes.
Yeah.
So first of all, you should know types of diabetes as per the ICD-10 classification, and how to use insulin code, whether to code or not.
Yeah,
How to code diabetic complications, and what are the guidelines? What are the code also? Like diabetic with CKD, then you have to code diabetes and we have to code CKD stage. So these things are there which a coder has to concentrate more to clear the exam.
So even in our discussion also, you said it's an off knowledge is different. You need to have a complete
Yes,
full
complete knowledge, yes,
knowledge
yes.
and the skills. I will give an example, sir. As you said, diabetes is we know everyone in ICD coding projects now. If you take a type, the top 10 errors now, diabetes is in a top 1, 2, 3.
It looks very simple to
Yeah,
code,
simple.
but there only we get a lot of errors.
Yeah, sir. Even understanding the code descriptions, I seen a beautiful way in ICD also, sir. The code descriptions and the guidelines also, everything is very precise and accurate. It says this is it. So there is no chance to presume anything. So the code
Exactly.
description is very precise.
Exactly.
If you see,
Yes.
most of the people
Compared to
understand.
ICD-10 coding is very precise.
it's
That's
very
why we have more number of codes.
Yes, sir. Most people thinks that 11 is just a code for the diabetes, but the precise information, accurate information is without complication.
Exactly.
Yeah, so when you code without complication, you cannot code with complication. It's an
Exactly.
opposite
Understand.
information,
Yes.
contradiction,
yes.
right? So these things, so this is always skills is added. How to understand the code description is also an important. It's a
Exactly.
basic thing.
That's why I say clearly that trainer should be a doctor. Because doctor only, they have seen the clinical concepts, right? They went to, they see a lot of patients, right? They see in live. They can teach you properly. See, anybody can teach the coding. So I don't say somebody is superior, somebody is inferior. So everybody has their own style of teaching. But if you learn the clinical concepts, is very good for you, for the good career also.
Yes,
Yep.
sir.
And again, for non-diabetes, coming to the topic of nervous system, pain management is very important. Pain management. How to code Parkinson disease, Alzheimer disease, and pain management. You get a lot of questions on this in the exam. And next, how to code hypertension, hypertensive heart disease,
Yes.
hypertensive heart disease with CKD. How to code STEMI and STEMI. Angina pectoris. These are very important topics from the chapter number 9. Okay. And from chapter number 10, very, very important chapter. You may get a lot of codes on HSC coding also. That is called COPD coding, pneumonia, asthma, right? COPD exacerbation, emphysema, always confusing part.
Yes,
so
sir.
any ICD, any certification, any coder going for certification, make a note. Concentrate more on the neoplasm coding, diabetes coding, hypertensive heart disease coding, and also from the pain management and the COPD coding. And you have to learn everything, but they are the main topics which you get in live work also, even in the exam also.
Yes, sir. Correct.
And you have to learn more in about the clinical, even clinical concepts. Yep. From chapter number 11, diagnoses system, you should know how to code the ulcers.
Yeah.
With bleeding, without bleeding, with obstruction, without obstruction, perforation, without perforation. So you should understand the difference between all these terms. You should read the document properly, and then also because we have choice of codes. Then you have to code appropriately. Crohn's disease, right? So they are the very important codes. Next, from chapter number 12, you have to learn how to code pressure ulcers. It's very decubitus ulcer, pressure ulcers, right? So you have to know how to assign the stages. In chapter number 13, you have to know how to code the osteoarthritis and rheumatoid arthritis, very common, right? And chapter number 14, you have to learn more about the, especially CKD stages, very
Yes, sir.
important,
Yeah, different
UTI,
terms.
CKD stages. And you may get a lot of questions from the male reproductive system and urinary system also. Chapter 15, pregnancy, childbirth and puerperium.
Yes, sir.
Very, very important chapter. In medicine, we spend more than 4 days to this chapter, 4 to 5 days.
Yeah.
Because, a lot of things are there, like how to code
Yeah.
abortions, how to code normal delivery, and how to code cesarean delivery, right? So it's very, very important, the coding, yes.
So as I said, pregnancy coding, some people feels difficult because some default information has to given, like
Exactly.
pregnancy status, weeks of gestation. Based on
Yes.
the weeks of gestation, how to give the last character.
Exactly. How to
So,
assign last,
yeah.
the 7th character or 6th character, 5th character is very important.
So many Z codes, G codes, which
Yes,
the
the G codes
factors
are there. Yes,
influences
yes.
the patient health and
Yes.
also health care.
Exactly.
So there are some default information that coder has to read
Yes.
the document and need to give. It's
Exactly.
not we cannot see in the document and we can
Yes.
give an
So
codes.
15, chapter 15, at least you have to learn more than 200-300 questions. You have to practice with interpretation, and you have to ask the trainer to explain them compulsory, right? And we get a lot of questions from the signs and symptoms. So a lot of rules are there. You have to follow the rules. R codes. Injury poisoning. Very important chapter. So we have so many codes in injury poisoning. Yeah.
Coming to these sign and symptoms, R codes, severe sepsis, you just said in chapter 1 also.
Sepsis code is from the chapter number 1. There's the A series code for the organism. For severe sepsis, you have to code from the R codes. With or without septic shock.
Yes, sir. You understood it correctly. Whenever I, in an interview also, whenever I ask how to code severe sepsis, how to code severe sepsis with septic shock. So they will say, everyone says that compulsory 2 codes, and along with that, is there any system failure is there, no? Circulatory failure or any system failure, that also need to be coded.
Yes, correct.
But no one says that we need to code severe sepsis. Everyone says severe sepsis and sepsis, but it is not a sepsis code. Sepsis with organism code.
Exactly.
Every chapter has a meaning, sir, actually, in ICD.
No, it's properly classified.
Yeah, sir.
Yes.
Chapter 1 is not infections, infectious diseases.
It is called certain.
Yeah.
Certain means what? Only few codes are there.
Yes.
Some codes in other chapters. See,
Yes.
coming to sepsis here, even though a experience of coder experience with 10-15 years, still they have confusion about sepsis. They have to see the SOFA score, SOFA, SOFA score. They have to see the clinical indicators. They have to see the documentation line by line, and then assign the code properly. Especially in the IP coding, sepsis, septic shock, severe sepsis coding is very, very important. If you do a small mistake, entire DRG will change, reimbursement will change.
Yes, sir.
So here ultimately what it is, focus more on the clinical concepts and focus more on the guidelines, and then you practice those things. And coming to this chapter number 19, injury poisoning. You have plenty of codes in injury poisoning. You should know how to code poisoning, how to code adverse effects, how to pick up the injury codes based upon the location. And the seventh character is very important, ADS. A means initial encounter, D is subsequent, S is sequel. Right? That's very, very important. And external causes.
Yes, sir.
Still, if you ask me, this chapter, even I have a phobia about chapter number 20.
Yeah.
Even today also, I get some confusion how to pick the code from the external cause, because so many codes are there.
Yes, sir.
So
many reasons.
it means I say I have to spend more time for the external cause codes. But however, when you're going for certification exam, you have multiple choice.
Yes, yeah.
So automatically you can see the answer in front of you and you can pick the code. But in the live work, you have to go through index compulsory. Remember, any coder going for certification exam, index is the king in the ICD.
Yes, sir.
You have to lead the code through index.
Yeah. While leading
And
through
check the tabular also.
Yes, sir. While leading through the index now, we can understand how it is classified.
Exactly. Yes,
It's an important one.
See, index has more terms compared to the tabular. So I'll give an example. If you see SNOMED, SNOMED codes are there. SNOMED has 4 lakh concepts. In ICD-10-CM, we have only 70,000 codes. What about the 3.30 lakh of terminology? Means they're hidden in the index.
Yes.
And some are in the non-essential modifiers. So index is very, very important. We don't skip the index. Don't jump to the tabular immediately. Refer the index, lead the code, check the tabular, confirm the code, and based upon documentation.
In reality also, sir, if anyone has, not agreeing on a fact or in a scenario, the last everyone agrees on if we go through the index, so what it is leading, then
That's
it is
correct.
correct.
Exactly.
Everyone agrees on that.
And one more thing, Dr. Naresh, on top of it, every coder should follow AHA guidelines. That's AHA Coding Clinic.
Yes, sir.
Every time AHA, they publish the AHA Coding Clinic magazine. Sometimes we get some controversy, we get some doubts. The debate always goes on. AHA is our masters. They exactly tell you how to code this, how to code that, right? They give guidance on about the coding. So follow the ICD-10-CM coding guidelines published in the book, and also follow the AHA guidelines also for the proper reimbursement and to clear the exam.
Yes.
Okay, and coming to chapter number 21, Z codes. Z codes are very, very important. So factors influencing health status, history codes, right, and counseling codes, etc. are there in the Z codes, right, in the Z codes.
Yeah.
So this way, in ICD-10-CM, focus on these topics. And if you ask me, every chapter, you have to practice minimum 200 questions from every chapter. 22 chapters, you have to do at least more than 15 to 2000 questions you have to practice, more than 3000 questions, then only you can clear the exam comfortably. Again, you're not studying to pass the exam, you're studying to do the work for the quality healthcare.
That is the problem, sir. You are saying we need to do the ICD, but in some certifications program, they more focus on the procedural coding, sir, not the,
See, the reason I tell one thing, because in the procedural coding, they have the phobia, because they have to assign the modifiers, So ICD is very interesting to anyone, because the moment when they come for training, we start with ICD.
Yes, sir.
And once we go to the procedural coding, they have to assign the modifiers, they have to learn a lot of medical terms. Ultimately, what happens, every student, they start again focusing more on the CPT. Now, once they focus CPT, then what happens, again they forget the ICD. So that's why what we will do is, we teach both parallelly. So ICD 1 week, CPT 1 week, ICD 1 week, and we correlate the chapters. Today, if I am teaching the integrated system, right, then I teach ICD integrated system L codes ICD. Afterwards, I teach the integrated system procedure coding. This is what happens, then there is no gap between the two subjects.
Yeah, sir. For any procedure, for any services in the healthcare, medical necessity is the patient problem that is reported by ICD. So even the more projects also in ICD related only. So even they practice on procedures also, the same importance has to given to the ICD-10 coding.
Every code, even not only ICD, ICD-10, CPT, HCPCS, it should be precise, accurate. We cannot say 99% accuracy. Accuracy should be 100%.
Okay.
As per documentation, golden rule, if not documented, it's not done. Don't guess. Query physician. And then only you have to assign the code. Right? So ultimately, if you cascade down to the entire this thing, if you summarize, a medical coder, if you want to go for the exam, you have to follow the guidelines, practice every chapter in detail, clarify all the questions with your trainer, and then go for the exam. ICD-10-CM plays major role not only in the certification exam but also during the job, because in HCC risk adjustment coding, in ICD, CPT, ICPC, everything is important, right? So the more you learn, the more you practice, you can clear the exam comfortably. Again, there are no shortcuts for any exam. You have to prepare, study, do the homework and practice.
Even nowadays, sir, I want to share this information. There is no shortcut. If there is any shortcut also, if you don't practice on every scenario, at the end, you need to do the work in a company. So it's not only a certification or a credential. So for sure, they need to have an experience on the every aspect of the medical scenario.
Yes.
So
that's what. Yes. So that's what I will summarize once again. Certification is must to get a very good job. Okay. It's a proof of education.
Yes, sir.
You have to prepare properly to clear the exam. After certification, you have to get the skill also to perform well in the companies, to get a good salaries. For that reason only, right from the day one only, you study properly. Practice more. Don't study to pass the exam. You study for your career. Study for the quality healthcare. See, with lot of trust, companies, they pay salaries, they expect accuracy from you. You should have dedication and the passion, that accountability. When you do documentation, you have to code properly. When you're in doubt, don't code. You can ask your seniors or you can ask managers. That's how the system works in the medical coding and medical billing.
In healthcare, quality is the matter, sir. Accuracy is the matter.
Yes, accuracy, quality is the matter, yes.
At the end, even whoever the employee in healthcare, if they are not performing up to the mark, then it leads to the...
Yes. So however, Dr. Naresh, medical coding is very easy to learn. It's not as rocket science. Anybody can learn the medical coding under proper guidance and proper practice. Maximum it will take 120 to 180 hours of total training and practice. So assume maybe 250 hours with practice can clear the certification exam. So anybody from life science graduation, like B Pharmacy, BSc Microbiology, Biotechnology, etc., you can take the training, you can have a wonderful career. But you have to clear the certification exam compulsory to get the very good job. Along with and that you have to get the skill.
Okay.